on the work of the Childhood Lead Poisoning Prevention Branch. Lead in drinking water and the lead service line replacement project is happening in communities throughout California. Our presenters today from the Childhood Lead Poisoning Prevention Branch include Maximilian Weintraub, he's an environmental program manager, and Danielle Ramos, who is our health program manager. They are joined also by Kurt Souza, the Assistant Deputy Director from the California State Water Resource Control Board, the Division of Drinking Water. At the end of the presentation, the speakers will be available for questions for about 30 minutes or so, maybe a little bit more, maybe a little bit less, depending on the pace. A recording of this presentation will be available on our website, listed on the right-hand side of the screen in mid-November. So look for it around the middle of next month. The link to our website will be posted in the chat for you. With that, I will hand it over to Max Weintraub to begin the presentation. Thank you very much for being here today. I'm glad to be here with you.
Thank you so much. My apologies for the technical difficulty. And yes, Richard, someone is talking. I apologize. It just took a moment. I assume folks can hear me now?
Yeah, we can hear you, Max. Sorry about that.
No worries, no worries. Thank you so much for the assistance. I greatly appreciate it. Well, I want to thank everybody for coming out today, and would like to welcome you to the discussion during National Lead Poisoning Prevention Week. We're very excited about this webinar series that our folks have put together here in the Childhood Lead Poisoning Prevention Branch, and we're very excited to have Kurt Souza joining us today. Before we get into the deeper dive that Kurt will be sharing about lead in drinking water, I wanted to provide a brief overview of the activity of the Childhood Lead Poisoning Prevention Branch, and just give a quick taste of the intersection that we have with drinking water. As we go through it, I'm going to talk a little bit more about the vision and mission of the branch, lead poisoning prevention as we're involved in it, lead surveillance and data management, case management, lead hazard reduction, and how we pull all those pieces together to facilitate childhood lead poisoning prevention. I'll also talk briefly about additional lead poisoning prevention resources. Next slide, please. So the Childhood Lead Poisoning Prevention Branch has a vision of a healthy, lead-safe environment where all children can achieve their full potential. Our mission is to eliminate childhood lead poisoning by identifying and caring for children who are lead poisoned and preventing environmental exposures to lead. We do this through 6 goals, the first of which is to establish and support a successfully administered and equity-centered childhood lead poisoning prevention program in every local health jurisdiction. And we'll talk a little bit more about those partnerships. The goal, too, is to develop and engage in multi-level transdisciplinary partnerships to leverage strategies for lead poisoning prevention. Goal 3, create lead-safe environments by identifying and reducing lead hazards where children live, play, learn, and spend time. Goal 4, advance public health best practices, policies, and interventions through data-driven research. Goal 5, timely detection of all children who are lead poisoned through universal evaluation and risk-appropriate blood lead screening. And Goal 6, provide equitable and child-centered care for families who are lead poisoned through integrated case management and environmental services. And the driver behind this goes back to some laws that are at this point 30 years old. In the late 80s, the Childhood Lead Poisoning Prevention Act established California's Childhood Lead Poisoning Prevention Program and set guidelines for annual reporting of the prevalence, causes, and geographic occurrence of high blood lead levels among children so that we can better understand where children are being exposed and what might have been some of the triggers for such exposure. Then the Childhood Lead Poisoning Prevention Act of 1991 established protocols for case management. In other words, how to better follow up when children were identified as being lead poisoned. And then finally, in 1995, Health and Safety Code 100,005-250 established a program structured on federal abatement requirements to accredit lead-related construction training providers and certified individuals to conduct lead-related construction activities, including inspections, risk assessments, and abatement, with the idea being that by so doing, we would be able to remove some of the household lead hazards that might be that are contributing to childhood lead exposure and lead poisoning. Next slide, please. So there are a couple different ways. Next slide. So there are a couple of different ways that we do that. One is by raising awareness, and we have a very vigorous outreach and education program through activities that we directly provide, as well as through the activities of our partners. In 2020, more than 78,000 families and residents were reached through 1,323 health fairs, media events, and collaborations with local businesses and groups. There was also outreach targeted to more than outreach activities performed on more than 500 occasions by healthcare providers, and there are 28 lead education materials in up to 20 languages that are available on the Childhood Lead Poisoning Prevention Branch website. Next slide, please. We also closely track when children are being screened for potential lead exposure, so that we can better understand when such screening identifies children as being exposed to lead and potentially having high enough levels that it would trigger a state case. We can't collect and analyze childhood blood lead screening data as well to identify trends and recommend policies to eliminate childhood lead exposure. And in 2020, there were 368,813 children under the age of 21, and most of whom were under the age of 6, who were tested in the state of California. Next slide, please. When children are identified as having sufficiently high levels of lead exposure that it triggers a case management, we conduct or our local health partners conduct home visits to children with elevated blood lead levels that meet the state case definition to provide ongoing case management services, a home inspection, and remediation of lead hazards, including potentially paint, dust, soil, water, and personal items. We also provide monitoring, outreach, and education, and encourage venous retesting to children with elevated blood levels below the full state case-making criteria. Now, this activity, in the past year, has supported childhood lead poisoning prevention and case management for more than 5,000 lead-poisoned children by public health nurses in 48 local health jurisdictions, as well as direct services by our branch in 13 jurisdictions that lack such local public health nurses. In 2020, that included 216 home visits conducted for full state cases, as well as case management services provided to 4,936 children with elevated blood levels that were of concern, but that did not necessarily trigger full state case-making criteria. Next slide, please. So how do we do that? Well, the branch supports children that have been identified as lead poisoned, and the way we do that is we ensure that these lead poisoning prevention and management services go to the, it should say 13, I apologize, 13 local health jurisdictions and funds 48 local health departments. Next slide, please. So for lead hazard reduction, what we do is we certify workers to identify and safely abate or remove lead in buildings. Now, much of the work in primary prevention is focused on removing lead before a child is exposed, and that work has been supplemented in recent years in a number of different ways. Now, to perform that work, we certify lead-related construction professionals, and there have been 10,636 certifications issued in 2020. There were also 18,590 lead hazard evaluations that were performed for lead-based paint and contaminated dust and soil in 2020, and there was actual removal in the cases of 1,840 situations where lead hazards and lead-based paint had been found to exist. And to support that effort, there is quite a bit of funding that we are hopeful will support it and increase it in the coming years. As folks are aware, in 2019, there was the final settlement in the final settlement of the lead paint settlement that had been going through the courts for 20 years, and it was a $305 million award to the counties of Alameda, Los Angeles, Monterey, San Mateo, Santa Clara, Solano, and Ventura, as well as the city and county of San Francisco and the cities of Oakland and San Diego. And that $305 million was split between those jurisdictions to address lead paint-related hazards, and it is being paid for by companies that formerly were lead paint manufacturers. In addition, within the past few years, $13 million has been awarded by the U.S. Department of Housing and Urban Development to reduce lead hazards in homes in the counties of Fresno, Los Angeles, Orange County, Sacramento County, and Ventura County. Now, that funding is being used by these jurisdictions not only directly for removing lead hazards in homes, but it's also some of the jurisdictions are figuring out ways to leverage that funding so that it expands its impact even further. And so we're really pleased that activity is taking place and certainly support those efforts. Next slide, please. And so where does drinking water fit into this for the Childhood Lead Poisoning Prevention Branch? Well, the Childhood Lead Poisoning Prevention Branch, when we do case management and go into a home, we sample and test for lead. And the sources that we look at are both housing sources, which include paint, dust, soil, and water, as well as non-housing sources of lead, such as food, cosmetics, herbal remedies, pottery. What we find is that, while we recognize that nationwide drinking water constitutes about a fifth of all the lead exposure for U.S. children, it's not that high. It's not that large a source in California. Nonetheless, it does remain a significant source. We do find it each year, and we do find drinking water each year in a home or homes as a contributor to a child being lead exposed. And so it is on that basis that we continue to closely track and sample for lead in drinking water. Additional information about the activities of the branch is available. The phone number for our general line is listed. And with that, I have provided a general overview of what the branch does. Please do contact us if you have any questions about our activities or the activities of our numerous local partners who play a critical role in this activity. Thank you very much.
And I'd like to welcome our next speaker, Danielle Ramos, the Chief with our Program Performance and Reporting Unit. Take it away, Danielle.
Thanks, Eric, and thanks for that great presentation, Max. Hi, everyone. My name is Danielle. I am with the CDPH California Childhood Lead Poisoning Prevention Branch. Again, thanks for that intro. Yeah, I'm going to be talking a little bit about just ways to protect your family from lead in drinking water. So next slide. So before I dive into discussing this topic a little bit, I'm going to talk a little bit about what lead is and where it can be found. So lead is a naturally occurring bluish-gray metal that is highly toxic and found in the environment. It is a poison. There's no safe level of lead. In fact, any level of lead in the body is dangerous. Even though lead is harmful, this metal has historically been used in many products over time for different reasons, but mainly due to its malleability and durability. Next slide. So some of the products and places that lead can be found include lead-based paint, lead in drinking water from lead service lines, and lead in the aviation fuel that's still used in small commercial airports, as well as others, which I'll get into in the next slide. But in regards to lead-based paint, if your home was built before 1978, it may have been painted inside and or outside with paint that has lead in it. And as the lead paint ages, it can chip off the walls and crumble into dust and fall onto your floors or in your yard. And so even lead-based paint that appears to be undisturbed can be a problem if it's on surfaces that children chew, or if, on surfaces that get a lot of wear and tear. So some of these areas do include windows, windowsills, doors and door frames, stairs and railings, and porches and fences, among others. And so the most common sources of lead in drinking water come from old lead service lines. In addition, lead-containing faucets and other lead-containing plumbing fixtures and leaded solder joints. And so a service line is the pipe that connects the water main to the plumbing in a home or building. And so when any part of that pipe is made of lead, it's called a lead service line. Lead service lines were installed primarily during the late 1800s through the 1940s. And so knowing the locations of these lead service lines is challenging for many people and communities, just due to poor record keeping and long histories of repairs. Lead can also be found in aviation fuel, which is still used in small commercial airports. Aviation gas, or avgas, is a fuel that's commonly used by small piston engine aircraft, and it's the last transportation fuel containing lead in the U.S. Lead from aviation gas emissions pollutes the air that we breathe. And so lead dust from these emissions can be found in neighborhoods around airports or found settling on soil and other objects that people may come in contact with. Next slide. Some additional sources of lead include prior use of gasoline, the dirt in your yard, household items, and work activities or hobbies that some of us are involved in. Lead in gasoline was removed in the early 1990s. However, the lead from gasoline used for many years settled onto our soil, and it's very difficult to remove. Some aircraft, off-road vehicles, and farm equipment are still allowed to use leaded gasoline. Lead can be found in the dirt in your yard, especially if you live near a busy road, near an airport, metal recycling facility, or near a lead battery recycling facility. Some factories, such as metal smelters, battery manufacturers, or battery recycling plants, currently emit lead into the air, which can then fall onto soil where children play, and then that soil can then be trapped inside and on shoes and on clothing. Lead can also be found in various household items like toys, dishes, pottery, and spices. Specifically in regards to dishes and pots, you can find it in the glaze or the paint. And so if you use dishes or pots with lead in them, the lead can get into food and drinks and into our bodies. There's more of a chance for lead to get into food and drinks if the dishes and pots are old, chipped, or cracked. Some common jobs and hobbies that use lead include battery manufacturing, radio repair, construction, working in or spending time in a shooting range, soldering, recycling, painting, demolition, scrap metal recycling, working with stained glass, pottery making, and casting fishing weights, among others. This is not an exhaustive list, and so we encourage you to learn more from our website, which I can provide you with at the end of my presentation. Next slide, please. Now I'm going to go into why lead is harmful, especially for children, and what it can do to the human body. Well, lead poisoning can lead to multiple health issues, especially in young children, which include learning behavior and attention problems, low blood count or anemia, and damage to the nervous system, kidneys, or other major organs. Even low levels of lead are harmful and are associated with decreased intelligence, impaired neurobehavioral development, decreased stature and growth, and impaired hearing. Higher amounts of lead exposure can lead to seizures or death. Again, there's no safe level of lead in the human body. And so most children who have lead poisoning don't act sick and don't look sick. Symptoms, if they are present, may be confused with common childhood complaints such as stomach ache, crankiness, headaches, or loss of appetite. One of the early signs commonly seen are speech delays. Some symptoms can mimic those of a cold, flu, or other illness. You can't tell for sure if your child is tested unless your child is tested for lead. All right, next slide. All right, so now I'll be going into how lead gets into your drinking water and ways you can protect your family. So water service lines are the pipes and joints, also known as fittings, that connect the water main under the street to the plumbing in your home. Service lines that contain lead are called lead service lines. Lead can get into your drinking water when a lead service line corrodes, is removed, or is replaced. Galvanized steel is another type of pipe that brings water into your home. When galvanized pipes get old and rusty, they can also become a source of lead in drinking water. And the California State Water Boards have developed an interactive map which you can use to learn which communities have existing public service lines. And so California water utilities are actually in the process of replacing lead service lines in California that they own. So for example, those include lines that run from the water main to your water meter, and that's taking place over the next 10 years. And some communities have already started this work. So when lines are replaced, water utilities will provide residents with a water filter and instructions to flush their pipes. Water utilities are not responsible for replacing private service lines that are owned by the homeowner or customers served by private wells. Next slide, please. Okay, so the next few slides describe steps that you can take to protect your family from lead in drinking water. So one step you can take is using a water filter that's certified to reduce lead, and just know when it's time to replace the filter. And When using tap water, you should flush pipes that have not been used for more than 6 hours until the water feels very cold. Use only cold water for drinking, cooking, and baby formula. Boiling water does not remove lead. If you plan on replacing the privately owned portion of the lead service line, be sure to work with the licensed plumber and coordinate with your local water utility. Next slide. If you're worried about your child being exposed to lead from drinking water or other sources, ask your doctor for a blood lead test. Find out if you have lead service lines. You may have lead service lines if they're gray or appear silvery when easily scratched with a key. You can also contact your local water utility for help. And lastly, review your consumer confidence report. This is also known as your annual drinking water quality report. You can grab that from your water supplier. And your consumer confidence report tells you where your water comes from and what's in it. Next slide. Next, I'm going to be sharing some activities that the Childhood Lead Poisoning Prevention Branch has been working on to spread awareness of lead service line replacement taking place in California. So our branch has created a multi-pronged outreach campaign that focuses on working in partnership with other organizations to inform communities about lead service line replacement. We've also been working with the California State Water Board to develop messaging around the risks to public health from lead service lines. And we've been developing community outreach materials to spread awareness of the public health risks and preventative measures that you can take during the lead service line replacement process taking place in California. Next slide. So over the last several months, our branch has been dedicated to working with partners to spread awareness about lead in drinking water. And we've been identifying different ways that we can share important information with families and communities about protecting public health. So some of the organizations that we have been working closely with include this list of organizations and agencies as well as others. So that includes our local childhood lead poisoning prevention programs that we work closely with, women, infant, children programs, Black infant health programs, comprehensive perinatal service programs, licensed child care facilities, county health officers, libraries across California, community water systems and water utilities, California Health and Disability Programs, providers and offices, Head Start and Early Head Start programs, schools, community-based organizations, and hardware stores, among others. Next slide, please. So we've developed different important materials for you, including infographics and posters, informative web pages, and answers to any frequently asked questions. You can find these resources along with many other materials to learn more about reducing exposure to lead in drinking water. And you can find these sources on our webpage found on the next slide. Thank you so much. That concludes my presentation, and I'll be able to answer any questions at the end of this webinar.
Thank you very much, Danielle. And I'm going to go ahead and turn it over to Kurt.
Hello, can you hear me?
Yeah, we can hear you.
Perfect. Hello, everyone. I'm Kurt Souza. I'm with the Division of Drinking Water, and I'm going to do a quick presentation here on our lead and copper rule when it comes to drinking water. If I could have the next slide, please. So here's a quick outline. I'll go over just the basics of the lead and copper rule. It's a very long and complicated rule, but just a little bit of it. And then some inventory requirements that are California specific, some California lead ban type things. And then how do you find out, what your service line has in it? There was a little bit on the last presentation. I'll show you some pictures. So next slide. So the lead and copper rule revisions were completed in 2021. The EPA started the lead and copper rule in 1991, so 30 years ago. and this strengthens their initial rule. Their three main goals were to better protect children, especially at schools and childcare facilities. So there are some specific details. There's some specific sampling requirements for schools and childcare facilities. They're trying to get the lead out of the nation's drinking water with this lead service line replacement program. And there's empowering communities through information. So there's a lot of public education and public notification requirements within the rule. Next slide. So the first thing about this rule that the water systems have to do is a service line inventory. They're due October 16th, 2024. So since December 2021, water systems have begun to work with this. We've put up a frequently asked questions and some templates for assistance to water systems. And I've been doing some various presentations about how to start your inventory. And this is a classic picture of the lead service line would be on the left-hand side, connected to a valve on the right-hand side, probably then going into your home. You can see the bulge on the pipe, and that's really typical of lead, where they heat the lead pipe and push it on to the connector that they're connecting to, like this is a valve, and it leaves a bulge on the end. That's a classic example of what a lead pipe would look like. Next slide, please. And this is another picture of a lead gooseneck. And a lead gooseneck or connector, or sometimes they call it a lead bend, is basically a smaller piece of pipe, usually around 2 feet long, that connects one piece of pipe to another piece of pipe. And it's usually because the two pieces of pipe don't line up. It's usually in the main, where the main line is in the middle of the road to the service line. Sometimes they're not, perfectly in alignment, and they need a smaller piece of pipe that can be bent and manipulated to connect the two pieces of pipe. And this was used in California. Not a lot, but definitely used. The next slide shows, an old picture of, this is how a plumber used to do it, right? He'd have a piece of pipe, and if you had a longer piece, a plumber could stick his knee on it and actually bend it in place so he could get two pieces of pipe put together. And then they would cut it to fit. So the next slide shows how water gets into your house. So we'll start on the left-hand side of the page here, is where the water main is. Now that's the water in the middle of the street, where the water system is moving water from place to place. As you can see, there's a little connector, and that's where the service line at the bottom is not even with the water main. So there had to be some kind of bent connector. Some of those connectors are lead, some are other types of material like copper. Then, as you can see, there is a system-owned service line and then a customer-owned service line. So that typically stops at the property line. So the system, the water system, owns the main, the connector, and the piece of pipe to your property line. But then from the property line to your home, you own it. And a lot of times those are two different kinds of pipe. Now sometimes they're not, but a lot of times they are, because what will happen is the water system will install the water main, they'll install the connector and the piece of pipe to the property line. Where in California, and this isn't a great picture for California because the water meter is shown in two weird places. Usually the water meter is placed at the property line. Here they show a curb stop, which a curb stop is just a valve, essentially. So there would be a meter there. Then from the meter to your home, when your home is built, a plumber or a contractor would connect your home to the meter. And that piece of pipe could be totally different than what the system-owned piece of pipe is. Now in California, on the next slide, or in a couple of slides, I'll show you that we already have the majority of the service line inventory on the system-owned service line. And we're really concentrating now on the customer owned. So here's some definitions in the lead and copper rule revisions. The LCRR has lead service line, which is basically a piece of lead pipe. Now, the next one is a gooseneck. So they don't consider a connector, a gooseneck, a fitting, a lead service line. They consider it a gooseneck or a connector, which is approximately 2 feet long or less. Those connectors are not considered a lead service line in the federal definition. There's also a federal definition of a galvanized service line, which is basically a metal, an iron or steel pipe, which is dipped in a zinc solution to prevent corrosion. And then they also have what they consider non-lead and unknown. So non-lead would be, copper, plastic, iron, steel. Unknown would be they don't know what it is, and you can label unknown. If you do label any of your service lines unknown in the lead and copper rule revisions inventory requirements, you have to consider them as lead until it becomes known, which is good. So it forces water systems to look for the material that's out there. So the next slide is what happened in California. So back in 2016, there was a health and safety code revision 1398 that required water systems to inventory the user service line, which is the water main to the meter, or the water system owned portion of the service line. So they were required to submit an inventory to us in 2018, 2019, and 2020. So the majority of service lines were inventoried. The water system owned service lines were inventoried then. Now the next slide is if any water system found any lead, which includes a lead pipe or a lead gooseneck, or there was an unknown material, the water system was required to submit a replacement plan. So every gooseneck, every lead pipe, and every unknown line has to be removed, or if it's unknown, it has to be identified. And the majority of the replacement plans we required to be completed in 10 years, and that was from 2020. Now, there's a link there that shows the map, and it's the same map that was shown in the previous presentation. And you can go to your water system and get all the data, and if they have a replacement plan, there's a spreadsheet that you can click on, and it'll give every address where there is a lead gooseneck, a lead piece of pipe, or an unknown. And they'll be labeled in there. So you could look for your address if your water system happens to have a replacement plan with us. The next slide gives some statistics. So the water system statistics as of July 2020, and we are requiring updates at the end of this year, and then our map will be updated, that 10 million user service lines were inventoried by community water systems, and 10,992 lead fittings or goosenecks were identified. One lead pipe was identified and was removed in 2020. There were 59,000 unknown service lines, so unknown material service lines. So 97 systems had either an unknown or a fitting. And we were provided replacement plans. One system had already completed their replacement plan. 12 systems of the 97 with approved replacement plans, 12 of the systems have lead fittings. The other systems have unknowns. So we're not quite sure. We assume they're lead until they're known, but known-wise, there are only 12 systems with lead fittings of those 10,992. Now, the next couple slides are kind of the history of lead bans in California. Now, there are two different rules that regulate these service lines. The service line portion, the water system owned portion of the service line is regulated by the Division of Drinking Water and the state of California in what we call waterwork standards and other things. So they have one type of regulations. The customer side is regulated by plumbing and construction codes, basically building codes that are either in counties or cities. So every county has some kind of plumbing code, which plumbers have to live by, you know, when they go and fix, they have to be certified plumbers when they go and fix some plumbing in your home. So all the way back in 1880, if you can believe this, San Francisco had a plumbing code, a very small plumbing code, obviously. It was just a few pages, I think. And in it, it did not list lead as an approved plumbing material. So when you look at these plumbing codes, and we've been doing some research on some of them, they don't ban lead. They basically leave it out of the approved plumbing material codes. So this one goes way back. Now, not all of them obviously go way back. And the previous speaker said most of the lead was installed before 1950 and earlier. And that's true. That's what we found also. Pretty much after World War II, when about 1950 came around, very little lead was available in California. And a little bit was used with goosenecks, but it pretty much was gone after that. Now, the next slide shows a Senate bill in 1883, and that this bill allowed cities and counties the power to regulate plumbing and drainage in buildings. So all the way back in 1883, this Senate bill said, okay, every county and every city, you can have a building department which regulates plumbing and drainage in homes. Now, it didn't all happen all at once, obviously, but that kind of started the process of counties, you know, starting to come up with these plumbing codes. And the next slide, all the way back in 1894, the State Board of Health labeled this statement where it said hygiene cannot approve of, said, okay, the house communication pipes are generally of lead. Hygiene cannot approve of their employment, or they are liable to be acted upon, especially by soft water, and in consequence, there may be a danger of lead poisoning of the customer. So basically, they're saying house communication pipes basically meant water going into your house and water leaving your house. They called them communication pipes back then. So all the way back in 1894, the State Board of Health said there's a danger of lead poisoning and you shouldn't use it. And that really stuck with a lot of counties. So that's one reason that there's not a lot of lead pipe in the customer side of the home, because the State Board of Health way back then really made a strong statement about the use of lead. So the next slide is, you know, we have a lot of good information on the water system side of the service line, mainly because the water systems own it, they built it, so they have records of it. But they don't have records of what's from the meter to your home because a plumber put it in or a contractor put it in, and it was approved by a city or a county. And, you know, older records just don't exist very much. And it's, you know, the water systems don't have it. So how can you figure out what's on your side of the line? So there's a meter box or a curb stop, basically what I showed you in that little diagram. There's also shut-off valves, usually right at your building inlet, like right when it goes into your home, or in the basement. Now, my house, it's right by my front door, right? So if something happens in my house and I need to turn off the water, I run outside the front door. There's a little valve right next to the house, right next to the base of the house. I turn it off. It turns off all the water in the house. Now, in there, you can see the valve, and you can also see the pipe on both sides. So visually, you can look at it. You can do a scratch test, a magnet, which iron sticks, a magnet will stick to iron, but it will not stick to lead. And then there is a swab test that water system, that some water systems are using now, which I can show you a little picture of. So the next few pictures are what does it look like in the meter box or valve box. So here's one that's not cleaned out. Sometimes you look in there and you can see the meter, but you can't see much else because there's a bunch of dirt in it. So sometimes you got to do some digging and you got to do some cleaning. So the next one is a cleaned one. So you can see that is nice and shiny, and that's copper, right? Easily identified. Now that wet piece there is the swab. Now what this person did who did all these things, anytime they found copper or metal, they used the swab test. So the reason they used it here was to see if there was lead solder that are soldering these two pieces together. So this one is clear. You can see that the liquid is still clear. Turns red when it's lead, and I have another picture of that. So this one's obviously copper. So let's go to the next one. You dig up this one, it's a nice white plastic. Pretty easy to tell that that's plastic. So that's plastic pipe going to your house. The next one. This one's a little messier, right? This is iron. Got to clean it off a little bit, but that's the swab, and it's still white, clear, liquid. So it's not lead. They probably put a magnet on this too. It probably stuck. So he didn't have a picture of the magnet. He just used the swab. So this is an iron pipe going to a home. So then the next picture is copper. But as you can see, where they put the swab in the joint, it's red. Might be hard to see on that, but you can see that it's a little bit red on the right-hand side where that arrow is. So that means that this was put together pre-1986, which in 1986, lead was banned in solder or limited in solder. So that little piece of red right there shows that that pipe actually had some lead solder to it. Now, if you, and this previous speaker spoke about this really quickly too, is that if you do some construction in your home and you know you have lead pipe, lead gooseneck pipe or anything, you really need to be cautious right afterwards, because when you do the construction, it shakes up the pipes, it breaks a lot of things off, and it all shoots into your house. And if you've ever, turned off your water for a while and a plumber comes and he's messing with a bunch of stuff, then he turns it back on and he turns the water on, and you see him when he turns the water first on, it comes out brown because he shook up everything. You got to kind of flush it all out. So you need to flush out anytime you do that. You need to flush out your home to get it back to cold water that's clear. And if you do a service line replacement, or if the water system's doing a service line replacement, they should provide you with some instructions. Now, if you do have lead, it is required by the lead and copper rule that the water system provides you with a pitcher filter. And it's, just a little like a Brita pitcher filter that's ANSI certified to reduce lead. And you really need to use that for all drinking and cooking for at least 6 months. So all your drinking water and cooking water should go through this pitcher to ensure that any shakeup that happened in your lines the lead will be caught by this filter. And then the lead and copper rule also requires the water system, if they remove a piece of lead pipe from your service line, to offer the customer a chance to do a follow-up sample. And it's usually a couple months after. So, you kind of get the new service line going, and then they can come and take a sample and tell you, if there's any more lead coming through your line or not. Now, the other thing about this is, where does the lead come from? Let's say you don't have a lead pipe. Let's say you've got a plastic pipe out there, but you sample your house and you still have lead in the water. So there's a couple of things that could be going on. One is, if you have copper piping in your house, like in the walls of your house, and it's older than 1986, your home is older than 1986, you could have that lead solder also fixtures before 2010. So in 2010, California made a low lead rule, and all fixtures, all valves, all faucet fixtures, and the pieces that connected to the valve, all of that had to contain low lead, which was less than, I think it's 0.25% lead, had to be in the metal that touched any of the water. So if you have fixtures or valves in your home that are older than 2010, they would have more lead in the brass or in the metal that is in those fixtures. So those are a couple of different things that could be contributing. And the previous speaker spoke of if the water sits for 6 hours, so if you're gone all day, or obviously you sleep at night, you wake up in the morning, you turn on that cold water to get that first drink, make sure a little water comes out, because you don't want to flush your whole house, but you basically want to flush from the water that sat in the faucet all night. You just want that to, put it in a glass, throw it in a bush or something, or just let it go down the drain. That first little bit is the part that you're trying to get out. And like the previous speaker said, it will get cold really quick. And then you've gotten the water out that sat in the faucet all night. So next slide, we're going to switch gears to the children, the schools and childcare facilities in this part of the rule. That this rule requires that schools be sampled once during a 5-year period from October 16th to 2024. California already sampled the majority of the, all of the public schools and some of the private schools. And we also have a website, on our website, a map that has all that data on it. That all the schools will be sampled again between 2024 and 2029. Also, all childcare facilities are being sampled right now. There's a California Department of Social Services has a licensing requirement that every childcare provider has to sample every tap in every childcare center, and there's over 15,000 of them. They have to sample them for lead every 5 years. And if anything is over 5 parts per billion, they have to take it out of service, and they have to replace the plumbing. They have to replace the valves and the fixtures and do a full replacement and put in new low lead filters. I'm sorry, low lead fixtures, not filters, fixtures. Next slide is funding availability. There's a lot of money for service line replacements. There isn't money for fixture replacement, but there is a lot of money for service line replacement. But it is provided to the water systems. The way EPA developed the funding, which I think it's a couple $1 billion. California gets a couple $100 million a year for it. It is loans and grants, and the money would go to the water system, but the water system could use the money to replace the private side lead. So if you have a lead service line on your private property, the water system could use that money to replace that portion of the line. And it's not available for private wells, people in rural areas that are on their own. This all goes through the state revolving fund, which is only for water systems at this time. I don't know if private wells or other smaller non-regulated water systems would have any funding available in the future. That would be more of a state thing. This federal money was just for that. And then the next couple slides, there's just a bunch of resources, gave you some links on what like Madison and Cincinnati are doing. They've got some pretty big programs, been going on for a while because they have a lot of lead service lines. They've got some good stuff in there. And then the lead service line, the lead service line collaborative is a great organization that has a lot of information on there about service line materials and how to do some identifications. I think that's the last slide.
All right, thank you, Kurt. And we're going to open up the chat and the Q&A. Try and use the Q&A as much as possible, makes it easier for us. I do have one question already, but we are going to open up the chat and be able to take your questions at a time. And actually, thank you. That was the question that I had. Will the slides be available after the presentation? Danielle, you probably know best how that would work.
Kevin, did you want to, I think you might have the answer to that.
Yeah, the recording of today's webinar is going to be available on the Childhood Lead Poisoning Prevention Branch's website. I don't have any plans to have the slides on there, but the presentation itself will be on there, and you should be able to easily kind of pause and play on the different slides to find the information you're looking for.
Sorry, we did have a hand raised. Let me see. Do we want to fill that question in the chat, or do we want to unmute?
I think we can.
Go ahead.
Let's see.
We'll go ahead and unmute. Hi, Wagi.
Hi, thank you, Kurt, for a very good and informative presentation. And my question is, you mentioned that the action level for child care facilities is 5 ppb, and I thought it was 15.
So the action level in the lead and copper rule is 15, but the action level for the child care facilities, they lowered it to 5. And it's because it's a child care facility, they wanted a lower level. So yeah, they're taking action at any fixture that is greater than 5 parts per billion.
Thank you.
Thank you, Wagon. If you could just remute, that'd be great. And we have another item in the chat. I'm Andrea. I'm concerned with either the lead line replacements that have been done without checking the private side, or that are happening now. How are we addressing the health threat given that can stir up lead?
So the lead lines that are being replaced now, the 12 water systems that have lead goosenecks, there aren't any lead lines, they have a permit from the Division of Drinking Water, which requires them to inspect the customer side of the line prior to replacement. And if there is lead on the customer side of the line, they are required to notify the customer and work with them to get it replaced. They are also required to provide flushing instructions and pictures to the customers.
Does that answer the question for you, or is there anything you'd like as a follow-up? Thank you. I do have a follow-up question as well. Someone had to step away when we were discussing how often the child care schools were supposed to have their water tested. How often is that? Yeah.
The schools are once during a 5-year period from the way the rule is written right now, from 2024 to 2029, a school has to be sampled once. And then after that 5-year period, the water system has to offer the sampling again. So and sample it if the school requests it. Now, there is, and I didn't go into this, but there is, the EPA is going to rewrite again the lead and copper rule revisions. They're calling it the lead and copper rule improvements, And there has been a lot of comments on the school and childcare facilities portion of the lead and copper rule, and they may be updated, but right now, yeah, it would be once and then an offer in 5 years. Now, childcare facilities are different. Childcare facilities have a state law that requires them to be sampled now once and every 5 years forever. There is not an end date on the childcare facilities.
Thank you. I'm scrolling up a bit. We had an earlier question on clarification regarding the older fixtures, and that was from 2010. There was possible lead in those.
Yeah, so in 2010, there was a lead-free law that lowered the amount of lead that you could put in the material that faucets and valves are made from. So if they're older than 2010, I think the lead content could go up to like 8% or something like that. But now it's less than 1%. It's 0.25%. I think that's the right number. But yeah, anything older than 2010 would not have what they consider now a lead-free label on it. And all of those faucets, when you go to Home Depot or Lowe's or whatever, and you look at them, it'll say lead-free, and they'll have like a little emblem on it. And they're either NSF, they're mostly NSF certified, which is a third-party laboratory that does the testing of the materials.
We have a couple related questions here. Irene asked that she says that she's having more parents and teachers inquiring into this. Are results supposed to be provided to parents? And as a follow-up, I see down here at the water testing in schools and child care facilities, is that available for public access?
So the old, the 2018 samples that were conducted at schools is still on our website. The new samples that will be done, I believe there is a requirement that the water system provide because the water system is going to do the sampling. So the water system would provide the information to the school. Now, this isn't a school law, so there's no requirement what the school does with it. There is also a requirement that the water system use a state certified laboratory, which sends that information to us at DDW. And then we will make another map. So all the data that comes to us will be on the map. Now, the child care facility is the same way. The child care facility are sampled. The samples go to the child care facility. They have to sample them on their own. I think they have to post them, or they have to do something with them with the parents. And then that information is also sent to us from the certified lab, and we are collecting it, and we are building the map tool right now. It's not finished yet, unfortunately, but we're getting there, and it'll all be posted as well.
Thank you. And another related one is, does the water testing for lead at child care facilities include child care at private homes too, or just child care centers?
Yeah, the law was only the centers. So there's 15,000 centers. I think there's over 20,000 homes, but the law did not include the homes.
And thank you, Danielle and Kevin, for providing the invite for our webinar tomorrow that will address a lot more of these questions. All right, and Carlos, after lead has been flushed from sitting pipes, faucets by running cold temperature water, how likely is it to have lead come back if you turn the faucet to hot running water?
That's not very likely. What usually happens is the water that sits on a material that has lead in it for a period of time, the water will pull the lead out of the material. So if the water just goes through, it doesn't really pick it up that quickly. It kind of has to sit. Now, no one recommends that you drink hot water, or because hot water, if the hot water is sitting in the faucet and it's warm for a while, it dissolves the lead quicker. So it can be a lot hotter, it can be a lot higher lead concentration in the hot side. So if your faucet has hot water that's in the faucet and then you turn it on, yeah, that should be flushed out as well and not used for drinking.
And there was a follow-up for 6 hours of sitting. Was that correct?
Yeah, that's the lead and copper rule requires that water systems take samples in homes after a minimum of 6 hours stagnation period. So they kind of assume that the 6 hours is how long it takes for some of that lead to come out. It's kind of a worst case. So if it's only been sitting like an hour, it probably isn't getting much out. But if it sits overnight or like all day, if you're gone all day and you come back, that's kind of the time that that you're concerned about, 6 to 8 hours type of thing.
I'm going to check in with Wagi again. He raised his hand again before I get to the other question in the chat.
What is the impact of hard water versus soft water on water lead contamination?
Yeah, soft water pulls the material out a lot faster. Hard water will actually leave a scale, kind of like, if you have hard water and, your shower has little white flakes on it, that's just the hard water stain. And it'll do that on the inside of the pipe. So if you have hard water, you don't get nearly as much of the materials, the lead or anything coming out of the piping. You basically just get the water. Soft water will pull the minerals out of the pipe.
So not installing a water softener would be kind of a protection, wouldn't it?
Yeah, so if you do have a water softener, it would pull more material out, more minerals out of the material, yes.
Thank you.
Thank you, Wagi. All right, returning to the chat. Okay, so if a daycare calls and needs sampling info, what agency should they refer them to? Who or what agency should they refer them to?
So every child care center has a license from the California Department of Social Services, and they have a office and usually a person assigned to them. That's who they should call. That person does the inspections, safety inspections and all that other stuff. They also would be the point person for this program, for the sampling program.
Thank you, Amy. Michelle asks, I heard something recently from an environmental professional that putting a water filter on could, in some cases, cause more lead to be discharged from some pipes. I guess it could make the water more aggressive. Can you speak to this?
Yeah, that was the last question about softened water. So if you soften your water, if you take a lot of minerals out of your water, like if you use an RO system, reverse osmosis system, which takes a lot of minerals out of your water, then you put it in a pipe, it's going to pull the minerals from the pipe back into the water because you have soft water. So the softer the water you have, or use any kind of softener or mineral reducer type of thing, a water treatment device, it will allow more water, more minerals to be pulled from the pipe in. A typical filter, like a carbon filter that you have in your refrigerator, or like a Brita filter, or one of those little filters that, little carbon filters that sit on your countertop, or you can put on your faucet, those things don't soften your water. They basically take the chlorine out, and they will usually have some kind of cloth kind of filter system, which would actually grab on to lead and reduce the lead coming out. Those wouldn't. It's mainly the reverse osmosis and the softening systems that could make it worse.
All right, we have a hand raised from Irene. I'm going to request unmute.
You may have already mentioned it earlier when you had said that water filtration systems, I think, need to be certified to remove lead and other heavy metals. When we have participants or families asking where they can find that information out, is there like a website that gives a list of filtration systems that are certified, whether they be built into the like faucet or like countertop or anything like that?
Yeah, so you just have to go to nsf.com or .org, one of the, I think it's nsf.org. They are the third-party lab that tests all this stuff. And if you type in, there's a place in there, you know, lead reduction, hundreds of those suckers will come up by company. I mean, there's lots of them out there. And then if you go to, you know, like I said, Lowe's, Home Depot, Ace Hardware, wherever, and they've got a little filtration system, it'll usually say NSF certified, and then there'll be a number on there. And then usually if a company, you know, is trying to sell whatever, it'll say certified to reduce, and they'll put a bunch of chemicals on there. And they'll usually put lead on there. It's NSF certified 58 is the common one that is used to remove lead.
Wonderful, thank you.
Thank you, Irene. All right, go back to our chat.
Oh, there it is.
Is there funding for the CCC to have their water tested for lead?
The CCC? Oh, the child care centers? Yeah, there was $5 million, I think. Well, there was $1.5 million, and then I think $4 more million given. And the money was wielded through to a third party. I think it's Sac State University. They have a program, and then they are hiring people to go out to child care centers that meet their criteria. So there's a whole criteria that California Department of Social Services put together to determine if a particular child care center could get some of this money. It also, if they find high lead fixtures, that if they replace a fixture, they can get reimbursed for that too, in qualifying child care centers. And they could find all that out through their Department of Social Services representative.
Thank you. And Michelle had a question. I had trouble finding a water filter that removed both lead and copper. How important is removing copper?
A little bit of copper isn't that bad for your health. So also, if lead is removed, copper's probably removed too. They just don't advertise that a lot because copper doesn't really have a high health effect. There is some health effects for copper when they get really high, but you rarely see that. Sometimes you see some really high copper in extremely new plumbing. And that's, yeah. I think if you went on to NSF's website and you looked up copper, hopefully you can find some, and hopefully they'll do both.
Thank you. And thank you, Long, again for the question. Now, hopefully tomorrow's presentation you can attend. That sounds like you might have a lot of questions for them. Can the child care centers utilize private vendors to test their water for lead? And they said that they get phone calls from the public with these types of questions.
Who can't say that again? I'm sorry, I missed the beginning.
Yeah, can the CCC utilize private vendors to test their water for lead? And they said that they get phone calls from the public with these types of questions. That's why they're asking.
Yeah, so the child care centers, the rule, there is a specific there's specific criteria on who can do the testing. And I going off the top of my head here, but I think you have to either be a certified tester from a laboratory, you have to be like a lead, one of those lead certificates that I think Max was talking about at the beginning. And the third one is like a operator of a water system. And I think there's a fourth one, but there's some specific criteria. So you can't just call somebody, you know, they have to meet a certain criteria to do it. And they also have to watch a training video and certify that they did a training, and they have to use a certain form. I mean, there's a whole process that they have.
Thank you for the question. We still have time if anybody has any questions for the panelists. I believe we addressed them all. If there isn't one, please, if there's one that we missed, please bring it up again. All right. In another minute or so, and let everybody have a chance to think and come up with any of the questions that they may have. We may have a survey that will come out to check and see how well this presentation was received. We do have another question. Thank you, Gene. Do refrigerator water filters remove lead?
Some do, some don't. So you'd have to look it up. If it just is a carbon filter that is removing chlorine, those can remove a little bit of lead, but they're not the best. But you can buy them that that are lead, that are certified to remove lead.
Another question here. How do you manage messaging for the benefits of drinking fluoride water versus leaded water danger?
Fluoridated water versus?
This might go to us as a public health side. How do you manage messaging for the benefits of drinking fluorified water, fluoride treated water versus lead water danger?
I don't know. That's got to be for Max and Danielle, right?
Yeah, Max and Danielle, this would be on your end. Thank you, Kurt. A question answering machine here for a few minutes.
Max, do you have an answer for Erica? I think he's trying to unmute.
Yeah, I tried to, there we go.
Okay, thank you. We're the technical challenges. I apologize. Can you please restate the question regarding fluoridation and lead?
Yeah, give me a second to pop that back up. How do you manage messaging for the benefits of drinking fluoride-treated water versus leaded water dangers?
Well, I think in California, it's actually pretty straightforward. In that fluoridation is sort of a day-to-day benefit that is broadly recognized. Not that there aren't some folks who challenge it, but certainly it's a broadly based broadly based recognized health benefit. And the lead issue is one that we really want folks to focus in on when replacement, lead service line replacement is taking place, because even though there's not many lead service lines that are recognized. There are unknown service lines that are recognized and that are being replaced. And we want to ensure that when that replacement occurs, the potential impact not only from the chemistry being potentially altered in the home lines, resulting in the potential release of any lead that may be present in those home lines coming available, is considered. But also we want to make sure that if that there's proper flushing when that occurs, and proper use of the Brita filter, as Kurt mentioned, during the period afterwards, while the new system sort of resettles. So it's a short-term versus a long-term issue, I think, is sort of the approach I would take. And as a long-term issue, the fluoridation benefit is great, but we do need to be aware that when service line replacement occurs, the potential for any lead present in the home system, the home lines may be disturbed and may become bioavailable, is considered.
Thank you, Max. Hopefully that answered your question, Erica. If not, follow up. Go ahead and put it in the chat. All right. Okay, so it looks like we've got pretty much all of our questions answered. I want to thank everyone for being here. Do we have a final slide, Kevin?
No, this was the final one, Eric.
Okay, just wanted to be sure. So thank you everyone for being here today. Reminder again, check the resources that we provided in the chat. If there's ever any questions that you have about this, feel free to reach out to us at the Childhood Lead Poison Prevention Branch. We can relay them to the proper channels, try and get the best answer we can for you. With that being said, thank you again. Be sure to check out our webinar tomorrow at the same time, same place. And we look forward to seeing you there then. You can get more information on the child care centers that was asked about frequently. So have a great afternoon, everyone, and thank you for being here. And thank you much to our presenters, Max, Danielle, and Kurt. Y'all did a fabulous job. It was a pleasure to be here and hear you all speak today. So thank you, everyone. Have a great afternoon.
Thanks, Eric.
Thank you.